Hi, I'm Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. We are pleased to bring you the 2018 January issue of our journal with several excellent papers. The Editor's Choice article this month is entitled Prospective Comparative Cohort Study Evaluating Incompetent Great Saphenous Vein Closure using radiofrequency powered segmental ablation or the 1470 nanometer endovenous laser ablation with radial tip fibers. This is a prospective non-randomized study called the VARICO-2 trial conducted by Dr. Lawson and colleagues from the Netherlands. The authors treated 311 patients with ablation of the great saphenous vein using either radiofrequency catheter or laser with a 1470 nanometer radial tip fiber. The authors found equally high 5-year saphenous vein occlusion rates, 96.2% after radiofrequency and 96.7% after laser treatment, with similar low post-procedure pain and short recovery in both groups with similar improvement in quality of life. The study concluded that endovenous great saphenous vein ablation with both radiofrequency catheter and the 1470 nanometer radial tip laser fiber had excellent and similar 5-year results, suggesting similar clinical efficacy for both techniques. The next paper I'd like to introduce to you is entitled Clinical Correlation of Success and Acute Thrombotic Complications of Lower Extremity Endovenous Thermal Ablation, written by Dr. Orshina and colleagues from Brooklyn, New York. Now, this is a single-center retrospective cohort study where the authors analyzed 1,811 vein ablation procedures performed in 808 patients. The study revealed that early thrombotic complications were more frequent with larger vein diameter, treatment of the great saphenous vein versus small or accessory saphenous vein or perforating veins, and endovenous ablation versus radiofrequency ablation. The study found no difference in successful early closure rates between radiofrequency and laser treatment, and that thrombotic complications were more frequent in patients with larger vein diameters and in those treated with laser, but the only significant predictor of thrombotic complications was the type of vein, the great saphenous, that was treated. The next paper that is available for free download this month is entitled Analysis of Threshold Stenosis by multiplanar venogram and intravascular ultrasound examination for predicting clinical improvement after iliofemoral vein stenting in the video multicenter international trial from Paul Gagné and colleagues from the United States and the United Kingdom. Now, this is a multicenter prospective non-randomized cohort study of 100 SEEP class 4, 5, and 6 patients who underwent stenting for iliofemoral venous obstruction. Baseline stenosis measurements obtained with intravascular ultrasound, diameter and area calculations were significant predictors of 6-month patient improvement in revised venous clinical severity scores. Venographic baseline measurements were a less reliable predictor of clinical improvement. The authors found that a greater than 54% cross-sectional area stenosis determined by IVUS predicted significant clinical improvement at 6 months. In non-thrombotic patients, however, stenting of a vein with a diameter stenosis greater than 61% measured by IVUS predicted clinical improvement. This study suggests that IVUS shows a significant usefulness at predicting when stenting iliofemoral vein obstruction in patients is useful with advanced chronic venous insufficiency, and when does it result in significant symptomatic improvement. The final paper I'd like to bring to your attention is on risk factors for presence and severity of pulmonary embolism in patients with deep venous thrombosis, written by Nancy Huynh and colleagues from Yale University College of Medicine from New Haven, Connecticut. This is a retrospective cohort study of 838 consecutive patients with deep vein thrombosis. 25.9% also had pulmonary embolism, and 16.1% had hemodynamically significant pulmonary embolism. The mean Caprini score was 6 ± 3 and had normal distribution in the study population. When divided into subpopulation of patients with pulmonary embolism and those without pulmonary embolism, the mean Caprini score was 6.1 ± 2.8 and 6.5 ± 2.9 respectively. So the authors found no association between Caprini score and hemodynamically significant pulmonary embolism. But pulmonary embolism was more frequent among those with proximal deep vein thrombosis. This study concluded that patients with proximal DVT should have more aggressive anticoagulant therapy and evaluation for pulmonary embolism. Now, these were just a few of the many outstanding articles from our January issue. To access these articles free this month, please download them on www.jvsvenus.org. Enjoy reading all JVS journals and let us know any comments or suggestions you may have to improve our publications. See you next time for the highlights of the March issue of the JVS Venous and Lymphatic Disorders.